So I'm Allie Waltien. I'm a certified child life specialist, and this is my colleague and friend, Julia Wick. Julia is a licensed clinical mental health counselor. And Julia and I work as part of the Cancer Patient Support Program and Mahana Magic Foundation, and we work inside the Vermont Cancer Center. Now, both Mahana Magic and the Cancer Patient Support Program are both nonprofit foundations that are just committed right here in the community, committed to serving the needs of cancer patients and their families. Mahana Magic specifically focuses on children who have an adult caregiver with cancer, while Cancer Patient Support Program offers psychological services, nutrition counseling, and financial support. And both Mahana Magic and Cancer Patient Support provide services to families in Vermont and upstate New York, regardless of where you're treated. So you don't have to be a Fletcher Allen patient to receive services through either of these foundations. And what's really wonderful about our respective positions is that Julia and I are able to work collaboratively to provide family-centered supportive services to all members of a family. So often in the past, Julia and I have done either family meetings or coordinated visits so that Julia's seeing the adults in the family while I'm seeing the children. And it's this kind of collaboration that really fueled our desire to want to talk about what comes up for families after a cancer diagnosis, not just for the individual diagnosed with cancer, but the ripple effects and how it seeps into other members of the family. So I'm going to begin the presentation by talking about the needs of children during this time, and Julia's going to keep going and talk about how to take care of yourself when you find yourself in that position of being both the patient and the parent, and the unique needs that can come up for that. So just a quick little background on me. Again, I'm Allie Waltien. I've been at Fletcher Allen for over 5 years now. The beginning part of my job there, I was working with pediatric patients before evolving my role to work with children who have an adult caregiver with cancer. So I've been doing that for about 2.5 years, and I also have personal experience of being a child and having a mother diagnosed with breast cancer. So, of course, the first question that everybody asks me is, well, what is a child life specialist? It's a really hard role to sum up, but I'll try to do it. The role of a child life specialist is really just to focus on the psychosocial needs of children and families in the healthcare setting. We strive to empower children with knowledge and equip them with coping strategies so that they may face any potential stressors in the family with understanding and confidence. We also promote healthy growth and development for children in the hospital setting by providing opportunities for normalization and opportunities for play. Children really learn about their world through play, so that's the modality in which we work with them. I always say that we wear a lot of different hats. We're educators, cheerleaders, coaches, advocates. It really depends on the needs of the family. Now, historically, child life really originated working with pediatric populations in the hospital setting, but you can find child life specialists in a lot of alternative settings now, whether it's a dentist office, a outpatient doctor's office, no matter what the case may be. But in the last decade, there's been a real movement to have child life specialists in adult settings supporting the children of adult patients. So for the purpose of this talk, of course, I'm going to talk about child life from this lens, the lens of supporting children through an adult caregiver's breast cancer diagnosis. So I'm going to touch on these really quickly. I don't have time to get into a lot of detail about everything, but these are the kind of services that child life specialists provide. Procedural education, preparation, medical play, those are all ways that we help to prepare children for any changes that might occur in their family or in their routine by providing these opportunities for developmentally appropriate education. And again, everything is through the modality of play. Therapeutic activities are activities that have a goal in mind. So it might be helping children express emotions or develop coping strategies. And diversion activities are really what they sound like. So if a parent is in the hospital overnight or coming in for chemotherapy treatments and a child is coming in to visit them, I can bring down books or movies or games, arts and crafts projects to engage the child and the adult. And I think that we can all agree that the hospital is a pretty overwhelming place, not only for us adults, but for children too. So providing opportunities to make sure that their needs are being met. Support groups, I facilitate a couple different support groups at Fletcher Allen for community members. One for children who have a parent currently being treated for cancer. And support groups are just really good ways to get children connected with peers who have some understanding of what they're going through. And that connection can really help to normalize some of those intense feelings that can come up for kids after a cancer diagnosis in the family. Bereavement support. Child Life has a strong background in grief and loss, so we provide support for families who are facing the death of a loved one. And advocacy, above all else, we just really advocate for the needs of children and families during stressful events. And when children don't feel like they have a voice in a situation or don't feel like they have some control, we're really there to try to show them that they do and provide ways for them to get involved. And it's also about, a lot of my job is really just building rapport with families, connecting them with appropriate resources in their communities, and making sure that I'm a friendly face to the kids that's available to them if they do need extra supports. So why is it important to have a child life specialist part of adult care? Well, I think it's really important to acknowledge that when somebody's diagnosed with breast cancer, they don't exist in a vacuum. Rather, everyone who comes into the hospital for treatments, they're part of a rich and detailed history and life that exists outside the walls of just trying to treat that cancer. And very often, and most often, children exist somewhere in that life. So whether it's your own children, or it's your grandchildren, or nieces, nephews, the child of your best friend, whatever the case may be, children are often involved. And I truly believe that cancer is a family diagnosis. It really affects a lot of different members of the family in a lot of different ways. And therefore, we must support families accordingly. So, you want to think about it this way. After a cancer diagnosis, just when children need their parents to be emotionally available, and just when they need that energy and attention, that's when the parents may find themselves with diminished energy and lowered ability to care for the children. And when you're diagnosed with cancer, you have to take care of yourself. And that's a really, really hard thing to do, especially when you have kids in your life. You're so used to putting them first. And Julia's going to get more into this in her topic, but accessing whatever supportive services are available to you and your family are just going to help to validate the wide range of emotions that can come up after a cancer diagnosis. So I want to read you this quote from an article titled "Witnessing Wonder and Hope," and it's from a journal called Family Process. It's an article based on a presentation given by the author Kathy Weingarten. If intimacy develops when people share what they truly care about and find meaningful, and if parents have a responsibility to protect their children from harm, how can a parent both be intimate and protective if what they truly care about would expose their children to harm? This quote really reflects the author's internal dilemma of how to be authentic with her children without being intrusive and overwhelming to them. So often the question comes up to me, what do we tell the kids? How do we tell the kids? Or even do we tell the kids? And I wonder if anybody sitting here today, has also had to process that feeling. That feeling of processing such heavy news and sitting and knowing that not only are you going to have to process that, but your children, the ones that are young and innocent, how are you going to expose them to that? It's an intensely challenging and it's a very personal dilemma. I believe that it's our natural instinct to want to protect children from some of life's challenging truths. However, this instinct is often misguided as it creates a disconnect for the children. And that experience of disconnect can be far more terrifying than the reality of compassionately supporting a child through a challenging event. I tell you, children know when something is going on in a family. They sense change, and they can pick up on the tiniest details. You know, imagine being a child and walking into the room and walking in on your dad crying and not understanding why. That leads children to imagine all sorts of really scary scenarios. The greatest gift that we can give children is not protection from the world, but the tools that they need to cope with the realities of the world. And this is vital, and it's really easier said than done. But again, the greatest gift we can give children is not protection from the world, but the tools that they need to cope with the realities of the world. By withholding truth from your children, you're sending a message that they can't handle the truth. And this can erode a child's sense of self-confidence, which can affect so many aspects of their life moving forward. And it may actually be an obstacle to happiness later on. But by including them in what's going on, you're sending a really powerful message. You're saying, you can handle this, and our family will work together to support each other through this. So therefore, you're not disconnecting your child. They're not alone over here trying to navigate everything that they're seeing and picking up on, but you're teaching them a really important value. You're teaching them that people support each other, families support each other. Okay, so it's one thing to commit to telling your children the truth and by including them in that conversation, but now comes the dilemma of, well, how do you do this? So some of the information that I'm going to talk about, and I'm going to throw out a lot of information now, but it sounds like it's specific to talking to children the first time about a cancer diagnosis, and I imagine that most people in the room might have already had that really first difficult conversation and might be long past that. But I think it's important to emphasize that a lot of this information, all of it really, can be applied to any challenging conversations you have with a child, anywhere on your cancer journey, or no matter what challenging circumstances come up during childhood and adolescence, and a lot of challenging circumstances do come up. So first and foremost, when you're talking to children, you just really want to consider a child's developmental age. So not their chronological age, but where are they developmentally? So you might have a child who's 10, but their emotional maturity might put them in a younger category. And that's okay. You just want to be prepared to speak to the developmental and emotional level of your own child. And I think it's really important, too, for me to stop for a minute and just acknowledge that it's one thing. I was going to say it's really easy for me to stand up here, but it's not. It's actually really scary. But it's one thing for me to stand up here and provide all this information and to talk about all this from kind of a logical point of view. But emotionally, it's a totally different story. And at the end of the day, you're the experts on your children, and you know what's best for them, and you know how they react and they handle tough situations at baseline. So everything that I say, take it and apply it to your own family and the children in your lives, and do what makes sense for you, because you want to follow your instincts. Oops. Okay, so where am I? So next you want to consider, well, what does your child already know about cancer? Do they have any previous experience with it? Maybe a grandparent, maybe a friend of the family. Perhaps you've been diagnosed with cancer, or you know somebody who's been diagnosed with cancer that's very treatable. The prognosis is very good, and you have every reason to believe that you'll lead a long, healthy lifetime after your cancer. But maybe your child has a grandparent who died from cancer, or their best friend's parent died from cancer. Whatever the scenario is, you really want to be prepared to talk to the experience that your child's had. So talk to their reality. So I suggest that when you're beginning to talk about cancer, you really sit down with your child and listen and hear how much they know about it, so you can gauge any misconceptions that they might have. I can't tell you how many times I've sat down with adults and they've told me, I don't think that my child has ever heard the word cancer. It's nothing that we've ever talked about. We don't know anyone. Come to find later on, yes, they've heard it at school, they've heard it on the playground, they've heard it in a TV show, a movie, or a book. So you really want to be prepared to speak to what they know about it and supplement important information about your experience and your reality. In talking about cancer, I really encourage families to think about these three things. And these are all from this book, How to Help Children Through a Parent's Serious Illness, which is by Kathleen McHugh. And it's full of amazing and rich information, and it's presented very simply, so it's very accessible, and I highly recommend it. But the first thing is tell them that you're seriously ill. So mom or dad or whoever it may be is seriously ill. You can say something like, honey, you might have noticed that mom has been really tired lately. We went to the doctor, and the doctor told us that mom has a bad sickness, and it's called cancer. The doctors are working to treat mom now, and we truly believe that she will get better. Of course, you want to speak to whatever the reality of your situation is. So that brings up the next part of the three things, which is tell them the name of the disease. Use the word cancer. I always think about Harry Potter when I'm talking about this, and if you're familiar with the book Harry Potter, you know that there's an evil, powerful wizard, Lord Voldemort, who people refer to as he who must not be named for fear of using his real name. But what happens when we do that is that we attach a lot of power to something. And so in the case of cancer, we're attaching a lot of fear to the word. And cancer is really a name for hundreds of kinds of diseases with hundreds of kinds of treatments and no one outcome. Yes, people do die from cancer, but many people, more and more people every day, live long, healthy lifetimes after their cancer. So it's important for children to know that. It's important for children to hear the word, to understand it, and to know that it doesn't mean just one thing. And, just adding on to that, children will probably hear the word anyway, so they're really good at kind of zeroing in on little things. So even if you're trying to shelter it from them, they'll probably pick up on it somewhere. So the next thing you want to tell them is your best understanding of what may happen. So children are naturally concerned about how does this affect me, and that's very developmentally appropriate for where they are. Children really thrive on routine because routine creates a sense of security. So a cancer diagnosis may disrupt a family routine, and that's okay, but you want to talk to your children about the changes that they might notice in the family moving forward. So if mom is going to be getting chemotherapy treatments, and she's usually the one to pick up the kids after school and bring them to basketball practice, but she'll be in chemo treatments in the afternoon and maybe feeling pretty crummy or tired, who's going to do that for the kids? If mom has to be in the hospital overnight or somebody has to be in the hospital overnight and they usually tuck the kids in at night, who's going to do that while mom can't be there to do that? So just helping the children prepare and plan for any disruptions in routine is going to help them to better cope with those changes when they occur. So you're telling your children the truth, but you're doing it in a supportive and reassuring way. You're couching it between love and support. You can say something like, the doctors tell us that they have every hope that I will get better, but the treatments are going to be rough. Or if, that's not the scenario, we don't exactly know what's going to happen, but we're very hopeful that this treatment will work, and right now I feel pretty good. But if anything changes, I'll let you know. So it's okay not to have all the answers. It's okay because, when somebody's diagnosed with cancer, there is a lot of uncertainty. If your child has a question that you can't answer, just be honest. Say, that's a really good question, and I don't know the answer for it. If there is an answer for it and you just don't know it, let them know that you'll try to find out and get back to them as soon as possible. But if it's the kind of question where there just isn't an answer, it's okay to validate that it's hard when we don't have all the answers. But again, you just want to reassure your child that no matter what, your family will support each other through whatever you have to face. Just like all of us, children really want to feel included and they want to feel valued. So another important piece in all this, as I throw all this information out at you, and hopefully I'm not overwhelming you with all of this, but you don't want to overwhelm your child with information that they don't want to know too. So let your child's responses be your guide, and kids will really vary. So some kids want all the information and they'll have a million questions, while other children won't want to know any of the details and want to maintain normalcy as much as possible. And both ways are fine. Everybody has different ways of processing things. So ask your child how much information they want. You'll be able to tell by their questions, lack of questions, body language, how much support they need at a given time. And it's also important when you're talking to children about cancer is thinking about how much does the child have to know. So of course I'm here to advocate for honesty and always being open and honest with your children, but it's important to note that there are some things that may not be developmentally appropriate to share or necessary to share with your children. So like hospital bills, for example. That's, financial concerns are really adult stressors, and that's not a part of this that's going to disrupt their day-to-day routine that they need to know about. Also, in talking with children about cancer, it's important for kids to know that cancer isn't contagious. Older children will probably know this already, but younger children, I feel like so much in like preschool and kindergarten, we're teaching kids about healthy hand hygiene and germs, and that's really being pushed at kids lately. So it might be confusing for children to hear that their family member is sick with cancer. So children need to understand that they can't catch it, so it can be explained to them in a way that they understand. So children often know about broken bones. They've seen somebody maybe with a broken arm or a broken leg. So you can't catch a broken arm, right? You can't catch cancer. It's also important for children to know that there's nothing that they did and nothing that anybody did to cause this. Nobody could cause this. Nobody did cause this. Children often have what's called magical thinking, and so they're perhaps recalling a bad thought that they might have had toward a parent last week or a recent fight. And children can really easily become overwhelmed with guilt for a situation that's beyond their control. So there are many times that I'm talking to families about talking to children about a cancer diagnosis, and the conversation gets pretty emotional. I can't tell you how many times I've gone into a room to talk to adults who are maybe newly diagnosed with cancer, and they start to become teary-eyed, and they say to me, I've held it together all day with all the other providers until you came in and started talking about the kids. And I feel bad about that. But of course that happens. The kids, that's one of the hardest things to talk about in all of this. Of course it's emotional. Something frightening is happening to you. Something frightening is happening to your family, and you're worried about your children. Some families are really nervous about having those serious conversations with their children because they're afraid that when they start talking, they're not going to be able to control their emotions, that they're going to start crying, and they don't want to show any emotion in front of their children, or they don't want to cry in front of them. It is okay to cry in front of children, and it's okay to cry in front of the presence of your loved ones. What you're doing is you're modeling for them healthy emotional reactions. It is sad, it is scary, and tears are okay, and they make sense given the scenario. But just like everything I've kind of talked about before, you want to be able to couch it in that love and that reassurance and that support. You can say something like, you might see me crying sometimes, and that's just because sometimes I get sad that I got cancer. I'm sad that I have to go to the hospital and to be feeling yucky. But I love you, and our family is strong, and we're going to support each other through this. There are going to be moments where we might all feel sad, but there's going to be a lot of moments where we feel happy and silly too. So you're just explaining to them the emotional reaction that they're seeing. And I will say, though, if you feel like in having a conversation with children that you're going to become so overwhelmed with emotion that you won't be able to explain to them what you're seeing, you might want to have another adult present to help you with those serious conversations. And that's just a good idea all the time anyway, but somebody who can kind of tap in if you need to tap out. So above all, if there's too much emotional reaction, children won't be able to understand anything past what they're seeing, so they need some help explaining that emotional reaction. I think most of all, this isn't going to take place in one conversation. This is a process. Guidance, reassurance, support, these are all ongoing. When children learn how to read, it doesn't take just one session for them to read fluently. This is an ongoing thing. Be prepared for questions at seemingly random times. And be prepared, especially with younger children, to say the same thing over and over again. It's really tough, but you can do it. So this is by no means a comprehensive conversation about how to support children through an adult caregiver's cancer diagnosis. We're trying to stuff in as much information as possible, and just so you know what resources are out there as well. Of course, there are going to be more specific ways about how to talk to a 3-year-old versus a 15-year-old. But you need to know that most hospitals and treatment centers do have supportive services that are available to address the psychosocial needs of children and families. So look into whatever supportive resources are available to you. I have my card in the back, and I'm going to have my contact information up on the screen. And no matter where you get treatment, or a family member gets treatment, or a friend gets treatment, like I said, Julia and I are available to anybody in the community, and I've often worked with people even across the country, just helping connect them to the appropriate resources in their own community. And it's also important to listen to your child, because sometimes I've noticed that children can be forced into kind of going into these supportive services when they don't either want or need the support at that time. If the time isn't right and your child doesn't want to receive the services, you just want to honor that reaction. Illness really represents a lack of control. And so sometimes the best intervention we can give somebody is feeling like they have some control over something. And remember that children cope by going in and out of a situation. Distraction for children is a healthy coping strategy to a point. If you start to see in the long term, and in the short term this is pretty expected, but in the long term, school performance declining, unrelenting expressions of guilt or loss of interest in interacting with other people, serious behavioral problems that aren't baseline, sleeping, eating patterns being disrupted. If that happens on an ongoing basis, then it would be important for your child to find additional support. Like I said, it is normal for children, though, to have emotional and behavioral reactions when there is stress in the family, and you can expect to see some of that in the short term. Also, remember, when children, have problems, it might not just be the cancer. So often after a cancer diagnosis, we attribute any reactions in the family to that cancer diagnosis. But the reality is that childhood and adolescence especially is full of challenging and trying experiences. So it's very possible that what a child is going through isn't just the cancer. So I've included some pictures on this slide that just of some art that kids did and activities that children have done with supportive services in this community, and it's an example of what is offered through Mahana Magic Foundation, who funds my position in Vermont Cancer Center. So I don't have time to get into all of these different interventions that I'm able to provide, or that Mahana Magic is able to provide, but like I said, I'm more than happy to talk to people on an individual basis at your own convenience, and please take down my contact information. Everybody's needs are different, so I give a lot of general information, but it has to be really tailored to the needs of your own family. I have a lot of books out on the back table, too. I have tons of resources that are, I'm happy to give out to families if they need some. So please reach out if you need extra support. I'm going to hand it off to Julia now, and she's going to talk about taking care of yourself.
Thank you, Allie. Can everyone hear me okay? Yeah? Okay. So, hi, Charlie. Do you need us? No. Okay, great. So Allie did a great job of talking about the children, and I think it's really our common experience and our human reaction to want to take care of our children and our loved ones, and to really focus on them first. And so what I'm really going to talk about today is taking care of ourselves, and that needs to come first so that we can be strong and healthy enough to do a good job in taking care of our loved ones. So briefly, who am I? I'm Julia Wick, again. I'm a licensed clinical mental health counselor. I've been on staff at the Vermont Cancer Center, the Cancer Patient Support Program within the Vermont Cancer Center for the past 3 years. I have 22 years of experience as a psychotherapist, and again, 3 years with VCC, about 10 years with Cancer Patient Support Program in one form or another. I, too, am a breast cancer survivor, and as you can tell by my horse Guinness, I am a horse lover. So my focus today is really going to be talking about self-care, taking care of us. But first, I just want to talk a little bit give you a brief overview of distress, as that is such a prevalent experience when we are diagnosed with cancer. Also, let me say, please excuse me if you're a caregiver in this room. I'll be speaking mostly to you as if you're a cancer survivor. I imagine most of you are, but those of you who are caregivers or other professionals even in this room, it also applies to you as well, because self-care applies to all of us across the board. So again, distress, such a common experience with cancer. So what is distress? It's a term to describe unpleasant feelings or emotions. May interfere with your ability to cope with your cancer, its symptoms, and its treatment. Includes feelings of powerlessness, sadness, and fear. May also include depression, anxiety, and panic, also very common with cancer. 35 to 40% of people diagnosed with cancer experience clinically significant distress. Now, I don't know about you, but I think that's actually a really low number. I think it's a lot more people, many, in fact, most people who actually experience a significant amount of distress. Distress is fast becoming the 6th vital sign behind pulse, blood pressure, respiration, temperature, and pain. So that tells you how we are now really beginning to look at distress as a very significant factor that influences the cancer experience. It's also important to know that distress can hit at any point in the cancer journey. When you notice something suspicious, during your medical workup after you've contacted your physician, can be very upsetting and distressing. Waiting for tests, diagnosis, waiting for surgery, waiting for treatment. The waiting process, I think, is one of the hardest times. Hearing the word cancer, that is a really, really tough thing to go through, right? Hearing that word, really hard. So I think it's also important to note that any time during the experience, during and after the diagnosis and treatment, so right at the very beginning, anytime during the treatment, and also it's important to know that distress can hit even long after treatment has ended. So other signs of distress, briefly, feeling overwhelmed, panicky, or dread. You may have excessive sadness. You may find yourself being unusually irritable or angry. You're not normally that way. You're having trouble concentrating. Memory issues are also really common. Feelings of despair, hopelessness. Maybe you're constantly thinking about your cancer. That's also really common. You may have trouble sleeping or eating, have difficulty coping. So initially there's that, oh my gosh, what just happened? The shock, right? Shock. Denial. Denial is also very common in the beginning, and it's also, just so you know, very protective, right? Because you've got to get through what's right in front of you. So it's not necessarily a bad thing. Sadness can hit, as we've been talking about. Sadness, grief, fear, all very common. So you may be asking yourself, how am I going to do this? Again, at any stage. At the very beginning, you may say, how am I going to get through this? You may be partway through, and even at the end after it's all over, and you're just like, how am I going to cope? So that's what we're talking about, coping with cancer. So what is to cope? What is coping? What's the definition? So to cope is to deal effectively with something difficult. To manage, survive, look after oneself, carry on, get by or through, or hold one's own. So, thanks for coming. How do we cope? So before I move on with the rest of my presentation here, I just want to say that I was walking to work one day and I was thinking about this presentation coming up, and I've given this presentation before, and I was thinking, well, you know, it's kind of basic. You know, you'll see me just kind of touching on the benefits of meditation, yoga. You'll see all that coming up here. And I thought, well, maybe it's too basic. This is a big conference, a lot of people perhaps coming. And I realized as I was thinking this through that we all in this room could probably list these things and say, well, this is what we should be doing, or we might tell our friends, this is what you should be doing. And I think we all know this, but I think also that we all at times need to remind ourselves. I know I myself get so busy with my day, and we can just kind of just get really focused on what we're doing, and stress can hit, and then we sort of lose touch with how to take care of ourselves. So even if you know all this, and it may be basic, my hope for you today is that you can take one nugget or one little piece of something that you can then say, okay, you know what, I'm going to add that to my day, or I'm going to change this up in my routine. I'm just going to do one little thing. So that's my hope for today, that you can take something from here that can be functionally helpful for you, that you can add to your day. So first things first, when cancer hits, as we all know, I'm sure, really important to prioritize. And also, let me say, when stress hits, because this also applies to any stressful situation, prioritize. So checking in with yourself, what do I need, right? One step at a time, one day at a time. Again, we've all heard that. We can say that. We can say it without even thinking. We can tell our friends, take it one step at a time. You know, when we can really truly take that in and begin to break our day down into one, literally putting one foot in front of the other, it makes the stress more manageable. So when tough times hit, you can break it down to whatever increment you need. It might be one day at a time. It might be one moment at a time. It might be getting through the next 5 minutes. So whatever you need, focusing on that, because that is what's in front of you right then. That can be, when you can really embrace that, then things start to become more manageable. Get support. So important. I know that all of you in this room know how important support is. Talk to someone. Just the act of talking about it and getting it out can be really helpful. Ask for help. Your loved ones and friends want to help you and be there for you. Maybe providing meals for you, or giving you a ride, holding your hand, going for a walk with you. Even the simplest things, like you may not think whatever about asking someone to go for a walk with you. You may not think you need it or they want to do it, but the simplest things can help both you and them. It helps them to be able to support you as well. Take time to reflect. Get so caught up in doing the task at hand and doing what you need to do. It's really important just to be able to go inside and take that time for yourself. It might be walking in a beautiful meadow, or as this gentleman is doing, going outside and being with your animals. In his case, it's being surrounded by his donkeys, which looks like a really comfortable place for me because I'm an animal lover. Speak your truth. Again, it's really important to express yourself. Identify your needs. We may assume, and oftentimes I think we do assume, that our loved ones know what we need. They know what we need, they know what we're thinking, they know where we're at. That's not necessarily always the case. It's important to let people know what you need. Express your feelings. Again, so important. And honor your emotions. It's also really important to remember emotions are fluid, right? They come and they go. So let them flow in, let them go, release them. I like to sort of envision a river. You know, take your stress and throw it in the river and watch it float down the river. When we are in that moment of angst, and we all know this, every single one of us in this room, we think that it's going to last forever, right? So that's the time to remind yourself emotions are fluid. I can release this too shall pass, because it's true, it will. Emotions come and they go. Express your feelings, again, letting it out. And one way to do this may be through journaling. And journaling really helps you release your emotions. Again, get it out of you. Get it out of inside of you where you're holding it. It also helps you take ownership of your experience. I think Allie was talking a little bit about helping the children have some sense of control. We also need that sense of control, right? When we can. So journaling really helps you take ownership of whatever your experience is as you're going through this cancer journey. Again, expressing yourself through art, which can be drawing, painting, creative writing, can also be a really nice way of getting it out. Music, dance, perhaps that's your venue of expressing yourself. Move your body. That's another really important thing as you're going through the cancer experience. Activity is your friend. So that may mean that means really honoring where you are in your experience and where your body is. So that might be going out to the mailbox and back. It may be taking a walk, whatever it is, get moving. So movement, activity, exercise helps with fatigue. It lifts your mood and gets you out of negative emotions. So it gets you out of that stuck place, right? So move a muscle, change a thought. It's amazing how using our physical body to express ourselves, so moving our body helps to shift and get us to a new perspective, and that's really what we're talking about today. So movement is your friend. Go for walks. Again, even short walks can help. Get out in nature when you can. Let nature rejuvenate you. It's a great healer. Get out in the fresh air, again, even if it's 5 or 10 minutes. Take in the beauty that surrounds you, right? There's a lot of it around. We can find it everywhere. Yoga. So probably a lot of you either do yoga or are familiar with yoga. That's widely recommended as you're going through the cancer experience. So some of the benefits of yoga: increases strength, flexibility, and your breathing capacity. It stimulates the relaxation response. And the relaxation response is a physiological change that happens in our body. Right? Our muscle tension goes down, our heart rate goes down, our blood pressure goes down, racing thoughts go down. It's an actual change that happens, and yoga can help you get there. Yoga reduces stress hormones like epinephrine, increases oxytocin, which is the trust and bonding hormone. So we have less stress and more calm. And who doesn't want that, right? That's a good thing. Yoga boosts oxygen to the brain, so we have less depression, more happiness. Also, I put in here, you don't have to be a yogi. I have patients sit in my office and say, oh, no, I can't do yoga. I can't touch my toes. I can't do that. And I had one woman that I was sitting with a few weeks ago, and she found herself in a yoga class, not necessarily at her own initiative. She was just she found herself there, let's say. And she came out of the class and she said, you know what? I really loved that, and I'm going back. And so you can be anywhere in terms of how flexible you are, how strong you are, whatever it is. Wherever you are, you can benefit from yoga, and it's a great thing. And also, I'll say at this point, Allie and I have some cancer support calendars in the back. There's lots of different places you can find yoga. If you're local, you can pick up one of those calendars. And Survivorship Now is, so yep, some of you are familiar with Survivorship Now. They offer free yoga classes for cancer patients. And there's lots of ways you can find yoga. So I would really encourage you, if you don't know yoga and you haven't done it, at least check it out. It's great. So again, relaxation we talked a little bit about. One way that you can do this is through deep abdominal breathing. And it's a very easy way to get yourself to a more relaxed state. And it restores balance to your nervous system, which is a good thing. And that's one of those things that you can do. You have to practice it, unless you already know how to do it. It's interesting when you check in with yourself. I could spend the next 20 minutes on this, so I won't. However, once you get the abdominal breathing going, you can do that anywhere. You can do it standing in line at the grocery store. You can do it, driving, and you can do it for just a couple seconds. It'll help get you to that nice place. Visual imagery is another great way to get to the relaxation response. Your body follows your mind. So it's a wonderful thing about visual imagery is that our body will respond to what's going on in our mind, which means we can either be in a really wonderful place, which we all want to be, at the ocean with a nice warm breeze, and so we will become relaxed because our body will respond to that. The very cool thing is that we can also bring ourselves there in our mind by using all our senses, and our body will respond in kind, as if we are there. So that's the really great thing about using visual imagery to produce a relaxation response. Your body will follow your mind. Progressive muscle relaxation is another way to get to that place of relaxation, and it's a way of systematically tensing and releasing different muscle groups in your body. It's a more active way to get to the relaxation response. It's also a really nice way to get there. It's great. Or you can simply relax in your favorite spot. Meditation. Again, perhaps many of you practice meditation. Also widely recommended for going through the cancer experience. So some of the benefits of meditation. Meditation produces that deep state of relaxation that we've talked about by shifting brainwave activity. Meditation decreases stress. You'll find less depression, anxiety, and fear. Meditation also reduces negative emotions, giving you that sense of inner peace and calm. It will help you to clear the brain clutter allowing for a new perspective, which again, that's a lot of what we're talking about today, is shifting out of that negative place. Shifting out of that angsty place, if you will, right? So meditation is another really great way to help you gain new perspective and make that shift. Meditation helps you to focus on the present moment, and as much as we can be in the present moment, we're going to be better for it. To be in the present moment, all is well, right here, right now. And the more we can do that, the better off we'll be. Because anxiety, again, I could go off on a tangent, and I won't, is really about what's out there, right? What hasn't happened yet, what's out there. So when we can bring ourselves back to right now, all is well. The nice thing, too, about meditation, even a few minutes, just a few minutes, can help. So briefly, different types of meditation that you might try: guided meditation, mantra meditation, mindfulness meditation. Perhaps some of you know Roz Grossman. She offers a mindfulness meditation class through our clinic at the Vermont Cancer Center. And I believe she's here today, or was here today. Deep breathing, as we've talked about. Something called Qigong, Tai Chi, yoga. You can also do walking meditation. That picture of the meadow, you can take yourself out to that meadow and do walking meditation. Prayer and gratitude as well. Feel your joy. It's another really important thing. There's so much heaviness, right, in the cancer experience. So for me, my place of joy is being on my horse. Every one of you in this room, you know what it is that brings you joy, right? So try to engage that. Try to do that. Play. Also, really important to find those moments where you can just let down. Have fun. Be in the moment, as we talked about before. Being in the now moment. In this now moment, right here, right now, there is an absence of anxiety or fear. So whenever you can be right here, right now. Lots of ways you can do that. You can focus on your breathing. Literally just bring yourself back and just focus on your breathing. Notice where you are. You can also just look around and really take in what's around you. You can name out loud. You can name what's around you, and that helps to shift yourself out of that really angsty place. Gratitude. I'll talk a little bit more about that in a second, but being grateful, having gratitude, focusing on gratitude, again, a nice way to bring you back into the present moment. Be kind to yourself. I think this is one of the most important slides of this whole presentation. I can't tell you how many people I sit with in my office who really hard on themselves, right? Am I doing this right? I'm resting too much. I'm not resting enough. I'm not doing this cancer experience right. And there's so much pressure to do it right. You know, whether it be cancer or those of you who don't have cancer in this audience, we do this to ourselves all the time. So it's really important. Take a step back. Be kind. Go easy. Go easy on yourself. Also take notice of yourself. What do I need right now? As I talked about in the very beginning, what feels good? You know, would you like a hot bath? Maybe take a nap, right? Cup of tea? Listen to nice soothing music. Whatever it is that helps you feel good. Maybe getting a massage or going with your best friend and having a spa day. Sounds like a good thing. Be your own best friend. I also think that's one of the most important things. So think about for a moment, how are you a best friend to your best friend? How do you treat your best friend? Right? So see if you can then turn that around and treat yourself the same way. Give yourself permission to be who you need to be and do what you need to do. So really think about, I challenge you actually to really think about, what would it take to be your own best friend? Things will shift for you. Fuel yourself well. So we all know that the fuel for our body is what we take in for food, what we eat, how we exercise, so how we treat our bodies, our outer selves, right? So the fuel for our mind is our thoughts. So again, thinking about what is the quality of your thoughts? How are you speaking to yourself? So we talk to ourselves all day long, and we talk to ourselves through our thoughts. So I would really encourage you also to start paying attention. What are you telling yourself? What are you saying to yourself? Are you beating yourself up? Are you thinking negatively? So maybe just start tuning in a little bit to that. If you find yourself thinking negatively a lot, talking negatively to yourself, you can do something called thought stopping and simply say, stop, stop. and replace the negative thought with one positive thing about yourself. And I know that everybody in this room can do that. I know you can. So again, think positively. Are you an optimist or a pessimist? How do you see this cup? See this cup as half full? Do you see it as half empty? So then I would also encourage you or challenge you to look for one positive thing in each day and write it down. There's something really powerful about writing it down. Again, we're talking about shifting out of that negative place. Writing it down can be a nice way to help you shift out of that. So a quote I really like by Marcus Aurelius is, "The happiness of your life depends upon the quality of your thoughts." We can really shift our perspective with what we think about and how we talk to ourselves. Lighten up. Again, we've been talking about, or I talked about before, the heaviness. We all know the heaviness of this cancer experience. It is heavy. It's painful. So whenever you can lighten up, laugh, watch a comedy, when you can. Laughter releases endorphins, and we all know about endorphins. Endorphins, it's our body's natural pain reliever and stress combatant. So we know that exercise releases endorphins. Laughter also does, okay? So that's really important. So be silly, take yourself away. It helps you detach from the heaviness and find objectivity and just give yourself that space to just kind of be, and to be happy and playful and fun and just laugh. Really important. Forgiveness. So I don't know about you guys, but I mean, I certainly recognize this man here, right? We've all at one time or another carried that heaviness on our back. So forgiveness really helps you to release the burden you're carrying. So really try to maybe think about, are you holding any resentments? Is there anything that you can let go of so that you are lighter and you don't have to carry that burden? It renews a sense of hope. And you will watch your relationships grow when you can forgive. It's hard. It's, again, I can stand up here. It's easy, easier said than done. I can easily say this to you. It's a hard thing to do. But if we can all challenge ourselves to do that, we'll be the better for it. So another quote I like by John Krakauer, who wrote Into the Wild. "When you forgive, you love. And when you love, God's light shines upon you." Whatever God means to you. Acceptance. So the be kind to yourself was, I think, probably one of the most important slides. I would have to say this is right up there with it. It's also probably the hardest slide. Because accepting, who wants to accept the word cancer, right? We don't want to accept that. We don't like it. We don't want to accept it. Acceptance doesn't mean liking something, right? It means letting go of what you can't control. So we are talking about kind of gaining a sense of control where we can and letting go of what we can't control, okay? It is what it is. That's one of the hardest things to hear sometimes, and it's one of the hardest things to just take in, right? So resistance only makes it worse. What we resist persists. So when we think about that and can really begin to move into that place of acceptance, again, really hard to do, really, really hard to do. It can just be really helpful. So I'm sure a lot of you in this room know the Serenity Prayer. I share this a lot. It's used a lot in 12-step programs and is a really nice mantra to use when working on acceptance. And it goes like this. God, again, whatever God means to you, okay? Could just whatever it means to you. I don't mean this in a religious sense. God, grant me the serenity to accept the things I cannot change, courage to change the things I can, and wisdom to know the difference. So in our particular situation, right, you might say something like this. God, grant me the serenity to accept the things I cannot change, my cancer, courage to change the things I can, the way I take care of myself through this cancer, and wisdom to know the difference. Oh, I'm just about out of time. Okay. Spirituality, again, I'm going to just really briefly go through this. I am actually past time. So again, considering your religious and spiritual community, knowing you are not alone, that's the important thing about spirituality, can also be really comforting during this time. Gratitude, the greatest healer we have. Practicing gratitude you will notice a difference in your lives if you actually maybe even keep a gratitude journal, and I would recommend it. Okay, so my last slides, and I'm just about done here. So just taking in what you're grateful for. The joy of new life, perhaps, innocence, nature's beauty, which again is all around us, especially here in Vermont. Togetherness, unconditional love. So my final thought today, self-compassion, self-acceptance, gratitude, and forgiveness are the gateways to happiness and sustained well-being. So thank you for being here. I apologize for going over. Allie and I have, we have cards in the back, calendars. Allie has some books. Sorry, there's no time for questions. We're here, however. If anyone has questions, yeah, we're here. So thank you very much.